Welcome friends. Today we are going to learn about malaria. Malaria, yet a reason to be worried about. As we all know, malaria is caused by the mosquito bite. The mosquito is a common flying insect that is found around the world. There are about 2,700 species of mosquitoes. Mosquitoes can fly about 1 to 1.5 miles per hour, that is 1.6 to 2.4 kilometers per hour. Like all insects, the mosquito body segments consist of three basic parts: head, thorax, and abdomen. Head. This is where all the sensors and the biting apparatus are located. The head consists of two compound eyes, antennae to sense chemicals, and the mouth parts called the palpus and the proboscis. Thorax. This segment is where the two wings and six legs attach. It contains the flight muscles, compound heart and nerve cell ganglia, and tracheoles. Abdomen. This segment contains the digestive and excretory organs. On an average, 40,297 Indians die of the mosquito-borne disease every year. Overall, the number of malaria cases is 9.75 million. A Lancet study said malaria killed an estimated 46,800 Indians in 2010. At present, except Himachal Pradesh and Jammu and Kashmir, which are above 5,000 feet, the rest of Indian states are malaria prone. All the northeastern states besides West Bengal, Odisha, Jharkhand, Chhattisgarh, Andhra Pradesh, Maharashtra, Gujarat and Karnataka are the high focus states. Let's fight out this monster. Before understanding malaria, first let us see the life cycle of Plasmodium, the causative organism of malaria. When a female Anopheles mosquito penetrates human skin to obtain a blood meal, it injects saliva mixed with an anticoagulant. If the mosquito is infected with Plasmodium, it will also inject elongated sporozoites, motile, spindle-shaped asexual cells, into the bloodstream of its victim. The sporozoites travel to the liver, where they enter liver cells and rapidly divide asexually. This asexual division, which is called schizogony, generates the next life cycle form called merozoites. The released merozoites invade other liver cells and enter the host bloodstream, where they invade erythrocytes. Once inside the erythrocyte, the merozoite begins to enlarge as a uninucleate cell termed a ring trophozoite. The trophozoite's nucleus then divides asexually to produce a schizont which contains several nuclei. The schizont then divides and produces mononucleated merozoites. The erythrocyte ruptures and releases toxins throughout the body of the host, bringing about the well-known cycle of fever and chills that is characteristic of malaria. Plasmodium enters a sexual phase when some merozoites in the erythrocytes develop into gametocytes, cells capable of producing both male and female gametes. Erythrocytes containing gametocytes do not rupture. Gametocytes are incapable of producing gametes within their human host and do so only when they are extracted from an infected human host by a mosquito. Within the gut of the mosquito, the gametocytes form male and female gametes. The resultant diploid zygotes develop within the mosquito's intestinal walls and ultimately differentiate into oocysts. Within the oocyst, repeated mitotic divisions take place, producing large number of sporozoites. These sporozoites migrate to the salivary glands of the mosquito and from there are injected by the mosquito into the bloodstream of a human, thus starting the life cycle of the parasite again. Now let us see the detailed information about malaria. The types include Plasmodium falciparum, Plasmodium vivax, Plasmodium ovale, and Plasmodium malariae. The incubation period of malaria is 10 days to 4 weeks. The symptoms of malaria include fever, sweats, shaking chills, headaches, tiredness, muscle aches, diarrhea, nausea, and vomiting. The diagnosis is done by peripheral smear for malarial parasite or malaria antigen. The treatment includes use of combination of artemether and lumefantrine or chloroquine. Radical cure. Primaquine is mainly used to treat the Plasmodium vivax or Plasmodium ovale malaria. Once the parasite has been eliminated from the bloodstream, the remaining hypnozoites must be removed from the liver, and this is done by administering a 14-day course of primaquine, that is 15 mg primaquine base daily. This process is called a radical cure. If primaquine is not administered to patients with proven Plasmodium vivax or Plasmodium ovale infection, there is a very high likelihood of relapse within weeks or months, sometimes years. When attempting a radical cure, primaquine requires the presence of quinine or chloroquine in order to work. If primaquine is given alone, the cure rate is only 20%. Prevention of malaria by preventive medicines. Taking medicines to prevent malaria is essential if you are visiting an area where malaria is prevalent. Reducing exposure to mosquitoes by spraying your home, sleeping under a net, covering your skin, and spraying clothing and skin. I hope you liked and understood this presentation on malaria. Goodbye, people. Take care.